The third thing that I learned is that when it comes to developing a strength training program for diabetes, the details matter. Based mainly on a systematic review and meta-analysis conducted by my research team, we were able to identify characteristics of different strength training programs that we were consistently seeing in interventions that were effective in lowering or improving diabetes risk factors whenever strength training was done on a regular basis in people that were at risk for diabetes. We're talking improvements in A1C, cholesterol, triglycerides, and body fat. In the most successful programs, exercise frequency was 3 times a week, working every major muscle group each training session. But keep in mind, doing it 2 times a week, every major muscle group each session, that's still effective in improving insulin resistance and improving blood sugar levels. For intensity, reps, and sets, the intensity should be at least 60% of 1 repetition maximum, or 1 RM. And I explained what that terminology means in the linked video. And if you're doing it at this intensity, the 60% of 1 repetition maximum, your rep range is going to be between 10 to 15 reps. You can see greater improvements in A1C if you increase the intensity and lower the reps. And we were talking intensities of 75, 85, and 100% of 1 RM. And 2 to 3 sets of each exercise seems to work well. Free weights, machine weights, resistance bands, body weight exercises, all these are appropriate to include in a strength training session. And you want to make sure that the majority of the exercises that you incorporate are multi-joint exercises. Resting between sets for 2 minutes is going to be appropriate in most cases if you're training with a rep range of 10 to 15 reps. But if you're training at a higher intensity, you're probably going to need a bit more rest, at least 3 minutes between sets. Remember to turn on the notification bell so that you're one of the first to know when my next video comes out. Number 4 on the list is the fact that our environment can impact our diabetes risk and the likelihood of us being active. If you think about where you live, ask yourself, do I feel safe? Is there sufficient lighting outside? Are there sidewalks? Is there a community gym or a fitness park near walking distance or within a 10-minute drive from my house? Are the places that I go on a daily basis within walking distance? My research team, we recently published the first questionnaire that measures how our different aspects of the environment impact whether or not we participate in strength training. We found that people that had easy access to fitness facilities in their neighborhood, those that had strength training equipment in their home, and those that had people in their life that supported them when it came to strength training, these people were more likely to meet the muscle strengthening guidelines for Americans. Over the last few years, it's been pretty exciting to see the number of fitness parks or calisthenics parks that have been developed in the Detroit area. People are more likely to be active when they see other people being active.